I wanted to introduce you all to Kudrat, who has flown all the way from US because he's interested to know more about Unani medicine because he's studying there Oriental medicine. So I wanted to know all the Unani professionals who are all practicing or studying all over the world, where all you will be having opportunities and how people are interested in knowing about Unani. So this is Kudrat. He is now which year of Oriental medicine?
Second year.
He is second year. This thing. From which university you are studying?
It's called in Santa Monica, California, Yosan University.
Mm-hmm. So in your part of study, you have about Unani traditional medicines. Or what do you study and what you have learned about Unani medicine?
Well, I started studying Unani medicine prior to me enrolling in acupuncture medical school.
Mm-hmm.
So I would study Ayurvedic medicine, and then I got introduced to Unani medicine because they all have similar philosophical outlook on health and disease.
Yes.
So that's how I was introduced to Unani medicine.
So you know something about humoral theory of Unani medicine and all, you're aware about it?
I've heard about it, I've looked into it. It's very similar to the Chinese theory, yin yang, and the 5 element theory. It's similar to the three doshas of Ayurvedic medicine. It's also similar to the Western herbalist perspective as well. They have heat, cold, all of these. I mean, the thing about medicine is, you'll have the same philosophical outlooks, but the terminology will differ.
Different, yes.
But it's alluding to the same thing.
Now, after coming here, how did you feel when I have spoken about hijama? You have done before also in US.
Yes.
And people just remove the blood.
Yes.
And after learning about the humoral aspect, imbalances which are being corrected through hijama and why it is part of Unani medicine. So, what difference you found when you have tried Chinese cupping also? Then now actual hijama you have flown all the way to Dubai to know about it. So how did you feel after doing it?
After doing Unani hijama?
Yes.
So after doing Unani hijama, I felt great. I mean, you guys obviously they take out much more blood. The Chinese theory is just stimulating and activating the channels.
Yes.
That's about it. I mean, they do bloodletting. They do bloodletting, but that's not the main reason. The main reason of why the Chinese or the traditional Chinese medicine does hijama or cupping is to activate the channels. If there's any stagnation, because in Chinese medical theory they believe that what leads to pain is stagnation.
Yes.
So if there's any stagnation, they use massage therapy or cupping.
Cupping, yes. So there is a lot of difference between Chinese cupping and hijama because here, the ministry are well aware the limits of both of them.
Right.
For Unani practitioner who are practicing actual hijama and the Chinese practitioner who practice the cupping. So here means they are not allowed Chinese practitioner to remove the blood because it is actually not in their concept as such for the removal of blood much. So they put some needles and all, few drops of blood is removed, that's all.
Yes.
While they are channelizing their channels, meridians, so that way. But Unani concept is for balancing of the 4 humors, that is Dam, Balgam, Safra, Sauda.
Right. In Chinese medicine, they do try to balance the yin and yang.
Oh yes, energy.
So they try to do that with cupping as well, and also acupuncture. So there is that similar concept, like in Unani Tibb, in Greek medicine you have the humoral system, and in Chinese medicine you have yin, yang, and qi, and the 5 elements, right?
Yes.
But at the end of the day, both systems try to bring rebalance to the body.
Yes.
Because they believe, like in Chinese medicine, disease is a state of imbalance, and health is a state of equilibrium.
Yes. Now I will be showing him about Unani herbs and all, how the formulations and all. He has seen the Chinese herbal combinations, the Majun, Jawarish. Have you heard about Majun, Jawarish, then Khamiras? They are part of Unani medicines. Form of medicine. The preparations are all different for different type of.
Are they names of herbs or just
No, the formulations.
The formulations. Okay.
Herbs are common in all the system, in the
Right.
botanical name and all, you can tell. We have Arabic and Persian terminology. The final product which is prepared by mixing of lot of herbs, some ingredients might use 15 to 20 herbs also in single this thing.
Yes, in the formula.
Formula, yes.
Yeah.
So they are having specific preparation techniques. So usually this thing in the different type of jams they are. So Majun is specifically different, Javaris is different, Khamira is different. There are different type of jams.
Okay.
Jams. So for GI disturbances they are called Javarisha.
Okay.
So those the technique is means they are means not powder for fine. They are not in fine powder because it has to stay long hours in the stomach. For to have treatments, the main action of the medicine should be beneficial for the whole GI.
So they try
so there are different type
Right.
form of this thing herbs, this thing.
Exactly, yeah. In Chinese medicine, that exists as well. So,
Yes.
like for example, if you want to add, if you want to make the herbal formula more tonifying, you'll add honey.
Honey, yes.
Because honey is a tonifying, it's a tonifying thing.
Yes,
Right.
and
It's
preservative,
tonifying.
good preservative also.
Preservative as well.
Yes, yes.
So it's because of the way a herb is prepared, it can change its energetics
Yes.
as well. So I mean, like I said, like it's very similar.
Mm.
I believe, like when I was talking to my teacher, you know, the ancients, they communicated with one another.
Yes.
They shared their opinions with one another, and
Yes.
they, you know, if an opinion was correct, they adopted it.
Yes.
And that's what was going on.
There is lot to discuss about all these things, but our video will be very long and it can't be posted, so I will cut short. Then the rest I will show you all about Unani practices and all our medicines and all these things. And till you are here, for how many days you are here now?
I'm here for a couple months, inshallah.
Oh, good, that's good. So on and off you can come, so more things we can show because
Inshallah.
we have all the alternative practices under one roof. So Unani,
Yes,
Ayurveda,
I was
homeopathic, all
surprised.
jazz.
Yeah, that was
Yes,
very
yes.
interesting because you don't really have that
Yes,
anywhere else.
yes.
You know, usually it's just
Yes.
That's
So nice meeting, Khadrat.
Nice meeting you as
Thank
well.
you guys. You will be benefited, I hope.
inshallah.